Isang mapagpalang araw po sa inyong lahat. I am thrilled to be here today to share our inspiring journey of boosting family planning through innovative demand generation strategies. Our story highlights the impact of combining effective outreach with community engagement, and I am excited to walk you through our experiences, successes, and lessons. Let's dive into and explore how we made a difference in empowering individuals and families to make informed choices about their reproductive health. Biñan was the richest municipality in the Philippines before its cityhood in 2010 by virtue of Republic Act 9740. In 2015, the city of Biñan, an independent component city of the province of Laguna, became the lone congressional district of Biñan, the first lone district in Laguna. The city has 24 barangays. It is the smallest local government unit. Data from the Commission on Population and Development, Region 4A, indicate that Biñan City ranks among the top 20 local government units in Calabarzon with the highest number of teenage pregnancies, reporting 4,896 cases between 2016 and 2020. In response to this significant public health concern, the city government of Biñan, under my leadership, has actively sought solutions to improve the sexual and reproductive health of its adolescent population. In 2022, I initiated a partnership with the CPD Region 4 Calabarzon, DOH Region 4, and the Swilig Family Foundation in implementing the Challenge Initiative, aligned with the city's broader adolescent health and development and responsible parenthood and family planning. TCI aims to create adolescent and youth-friendly cities across the Philippines, reducing teenage pregnancies by promoting positive health-seeking behaviors and improving access to family planning and adolescent and youth sexual reproductive health services. The City Implementation Leadership Team, which I headed, crafted a program designed based on thorough gap and root cause analysis. In the city of Biñan, we focus on a business unusual approach to address the issues of teenage pregnancy and unmet family planning needs, enabled young people to realize their full potential and contribute meaningfully to the community. Furthermore, we promoted the adoption of modern family planning methods among couples to address existing service gaps, thereby fostering responsible parenthood and contributing to the city's overall progress and development. Adolescents and youth were empowered to take control of their reproductive health and make informed decisions about family planning. They were capacitated as co-owner and partners of TCI implementation through their participation in CFF's Training on Leadership for Adolescent and Youth-Friendly Cities. To expand the reach of responsible parenthood services, we implemented in Usapang Serye, including Usapang Batang Ina and Batang Ama, provided responsible parenthood and family planning sessions to workers at the Laguna Technopark and launch Kalakihang Tapat sa Responsibilidad at Obligasyong Pamilya or Katropa and Si Lolo't Si Lola Kabalikat sa Pagpaplano ng Pamilya. To expand our services to the digital age, we use ePlano Family Planning Service and booking application in partnership with Friendly Care Foundation Incorporated, and conducted family planning caravans with CPD Outreach Itinerary Team and DKT Philippines Incorporated. These endeavors aims to address teenage pregnancies and unmet family planning needs in the city of Biñan, with the hope of decreasing teenage pregnancies and increasing the use of acceptance of modern family planning methods. Leveraging technology for family planning, Biñan's ePlano program. This initiative received recognition from the Friendly Care Foundation Incorporated and has resulted in the city of Biñan becoming leading user of the ePlano application among its 24 barangays. One of the early interventions in the city of Biñan is the tracking of teenage pregnancies and mapping healthcare facilities in 24 barangays, which have effectively reduced early pregnancies. The team worked as one in the implementation of innovative adolescent health and development strategies in schools and community. To address teenage pregnancies in the city of Biñan, we started Teenage Pregnancy Symposium in the schools and community, Youth for Youth teen trails, and AHD film dissemination. In these activities, we discuss the risk in teenage pregnancy that engage the participants in active discussion for them to have responsible choices on their sexuality. Then, breaking barrier sessions with parents, capacity building for service providers and partner stakeholders, establishment of a school and community-based teenage center, Buntins and Teenxenia activity. A framework for regularly monitoring and evaluation like quarterly implementation assessment, where facilities are visited at random to assess the quality of service, and regular pause and reflect session to assess gaps in data infused with coaching and mentoring sessions were done by city leadership team to strengthen the health system. The Servicio Arman Caravan is a comprehensive program in the mobile delivery of reproductive health and social services to 24 barangays. It includes promotion and provision of modern family planning methods, responsible parenthood, and education emergency preparedness training. The program's emphasis on meaningful community engagement contribute to the development of more resilient and empowered communities. On top of that, we upgrade 21 of our barangay health station level 1 adolescent-friendly health centers, while City Health Office 1 and City Health Office 2 adolescent-friendly health facilities were upgraded to level 2 accreditation, staffed with peer educators and adolescent specialists that help address issues on teenage pregnancies. Peer facilitators were also trained as youth advocates in school and community. Adolescents and youth were empowered to take control of their reproductive health and make informed decisions about family planning. They were capacitated as co-owners and partners through their participation in CFF's training on leadership for adolescent and youth-friendly cities. Looking into this as a proactive city health leadership team, a memorandum of agreement was forged between LGU Biñan, Commission on Population Development for Calabarzon, and Schools Division Office of Biñan to establish 3 school-based teen centers, both in public and private secondary schools. School-based teen centers serve as safe haven and drop-in and referral centers in schools, aiming to have well-informed, empowered, healthy, safe, and responsible adolescents. Aside from school-based teen centers, a memorandum of agreement was likewise forged between the City of Biñan and the Commission on Population and Development for Calabarzon and Barangay Biñan Council, led by Barangay Chairman Joel M. Abiso, for the establishment of a community teen center which serves as safe haven and drop-in and referral center in the community for well-informed, empowered, healthy, safe, and responsible adolescents. Based on the Field Health Service and Information System of City Health Office, there is a remarkable 78.52 reduction of teenage pregnancy cases in Biñan after 3 years of implementing the Challenge Initiative with Swilig Family Foundation. From 911 total teenage pregnancy cases in 2021, it is now down to 203 cases in 2024. These interventions help bring down the adolescent birth rate in Biñan to 19.6 per 1,000 live births in 2024 from 47.5 per 1,000 live births in 2021. Another notable result is the increased modern contraceptive prevalence rate from 71.3% in 2021 to 83.12% in 2024. Community's active participation and involvement up to the barangay level is evident in the numerous family planning and maternal, neonatal, and child health and nutrition activities conducted in 24 barangays of Biñan from 2021 to 2024. LGU Biñan is humbled by the opportunity to share its good practices during CPD's Regional Conference on Family Planning last May 21, 2024 at NEDA Region 4A Office, Calamba City. In this event, we showcase the positive result of TCI implementation in improving its adolescent and sexual reproductive health and family planning. Through strategic interagency collaboration, we optimized resource allocation and program effectiveness for adolescent and youth sexual reproductive health, responsible parenthood, and family planning. This unified approach minimized service duplication and significantly enhanced the design and impact of key interventions. The Challenge Initiative helped us look at the weaknesses in our health system and tackle health issues with co-ownership from partners built on trust and synergy. With the city leadership team being a product of the Challenge Initiative and Swedig Family Foundation, taking the helm of the City Health Office and the non-health agencies, we are confident that the local government can better confront health challenges ahead. To our partners, stakeholders, we extend our gratitude. Thank you TCI and CFF in partnership with CPD, DOH, and DKT Philippines Foundation for the opportunities to showcase the effectiveness of incorporating the demand generation and FA outreach in the service provision on family planning and adolescent health and development. What have we learned so far and our plans after graduation? First, strong political will and leadership. Second, multi-sectoral collaboration. 3, community-based advocacy. 4th, data-driven decision-making, sustained public education and awareness. This will not be the end, but will mark the beginning as we continue what we have started. We will carry our vision to sustain our hard work as we present our future plans in family planning and adolescent health. This is our commitment. TCI will become a way of life in the city of Biñan, the city of life. Maraming salamat po sa inyong lahat.